Continuando con el programa,
Now continue with our agenda. We will now listen to Germán Velásquez from South Center. First of all, let me thank ESAGS and the Ministry of Health of Argentina, because this is a very dear personal invitation to me, because I had the privilege, if I can say it like that, to be in this debate from the very beginning. I survived in the WHO thanks to the positions taken quite frequently by this sub-region, by South America, that pushed forward this topic. I hope that today I can continue working on what's going on in the WHO and be able to move forward, to be optimistic that the WHO is doing what they are doing thanks to UNASUR and countries from the South. Let me tell you that most of the people here know me and I know you. For those of you who don't, currently, after recovering my freedom of speech after leaving WHO, I am very critical to that organization, but I am one of those people that are in and out. We want a strong, independent WHO that has authority, leadership, that knows how to handle issues of public health worldwide. But none of those adjectives currently apply to this WHO, because the organization is drowning in its own problems. I followed with much attention Susan's intervention. She's not in the room anymore, unfortunately, and I agree basically with everything she said, but let me just say that this is not a cartoon. This is not a Tom and Jerry story, and nobody had fun with this story. This has been a war, a difficult, dirty war that has costed the position to many different officers in South Africa that were removed due to pressures of the United States when different pharmaceutical companies denounced South African medicine law. I saw high officers humiliated. Iro Suzuki, General Director of the WHO, in the Doha meeting in Qatar, he was removed from the room because they said that we were just observers, that we could not stay in the room when the ministers were discussing the Doha Declaration on Public Health. Both delegates from the WHO were removed from the room. So many publications were censored because some of the paragraphs were not supported by some countries. I saw a document in 2005, a briefing on intellectual property, 5,000 issues. We were forced by WTO and the United States to destroy the entire issue because it referred to human rights and access to medicines as a human rights. So this has been a war and is still a war. And I believe that Tom and Jerry is very pedagogical, but it's very naive also. It's very things have been much less nicer. I will briefly refer to these 4 items. I'm going to skip some of the slides. We're going to talk about what Claudia and Fernando mentioned. So first, I'm going to give a historical outlook of access to medicines. Recently, there has been a documentary, some significant articles, a publication, a trilateral publication, where they tell the story in a way that I believe is not correct, with serious errors. The trilateral bilateral publication mentioned a meeting in Norway about differential prices, which was the basis for the Doha Declaration. And that is false. That is not just my opinion, but also the opinion of the WHO director at that time. This is a book that really is telling the story not the way it really was. I'm going to talk about some failure indicators of the current R&D model, the largest threat for developing countries, where the dangers are, where they are trying to continue tricking us, and which were the answers of the WHO in 2014 to topics related to medicine. Everything started with the creation of the WTO. They create a model that is patent, monopoly, high price, restricted access. We chained medicine to this scheme. This is the story, the chronology, where I agree with everything said by Fernando. They started with a resolution in 1996. I think it is important to outline that the basis of the debate is the problem of the 49 pharmaceutical companies against the law. That was the root of the problem. That's the main antecedent, or the main reason for all this. This is something we saw in a very significant report, the Carlos Correa and Claudia report that launched the main utopia and solution to this structural problem. We also have another sad news, the demonstrative projects that I believe are just a distraction, introduced by Switzerland, the US, the European Union, Australia, and Canada. I'm not going to insist on this. This is April the 5th. Claudia and Carlos said they would recommend the start of negotiations to have a binding instrument for R&D and innovation in public health.
Esa convención.
This convention has not worked enough, in my opinion. I believe that academics should be more substantive, more substantial about this possible agreement. First, we should focus on establishing priorities based on public health criteria. There is a potential market. That is what things are based on now. We should go back to public health. We should coordinate public R&D on pharmaceutical products. Some funds are being not properly used, and there are initiatives of non-lucrative nature, such as the PDT, PPP, financed by Bill Gates. They are investigating on the same thing. They do not share the information because they want to keep Bill Gates funds, and they don't tell others what they are finding. Now, these are some of the indicators of the current model failure. Basically, the patent system and the monopolies that were created. I'm going to focus on 4 items. These are important indicators of the model failure. There are others. The way clinical studies are conducted, but I'm going to focus on these 4. First, pharmaceutical innovation has decreased. Prescriber magazine, which is a very significant independent magazine, conducted a study and found that from 2006 to 2012, Out of the products marketed that had a relevant therapeutical progress, there were 22 in 2006, 15 the next year, etc., etc. And the magazine says that in 2012, no new product of important therapeutical interest went into the French market. And this is France. Imagine other countries. If you have a new product, of course, you're going to target the French market because there you have consumers that can pay for the product. So it is one of those markets where the where the money is. This is a study from Peculi and colleagues, and they say that only 36 products were real innovations in 10 years. As to the costs of R&D and innovation, this is not current. You read the networks about medicines, and in the past 2 weeks we've panicked because the real cost of innovation, last week an institute in Boston said that is 2.5 billion to discover one molecule. And 2 weeks ago the industry said that it was 1.3, so in 2 weeks it was twofold, it was double. In 2011, some study says that discovering a new molecule is from $10 to $40 million. And today we have an initiative from MC that says they've marketed 6 to 7 products, and they say that to improve a medicine, $40 million are enough, and a new chemical entity would cost $100 to $150 million. So I believe that this is the basis, this is the essence of the problem. The international community, including the WHO, cannot make costs more transparent, cost of R&D more transparent, because if a product costs 2.5 billion or just 100 million, the price in the market will be completely different, and access to that medicine will be, of course, very different. Another indicator of the system failure is the cost of medicines. In the US, 10 of the 12 treatments approved by the FDA were above $100 million per person. What happened last summer in Europe with this medicine against hepatitis C, that states were negotiated with the company 12 weeks, $56 million, and they cannot still reach an agreement. The conclusion is that companies are stronger than the states, more powerful than France, not a developing country. In France, where you have 200,000 people in need of the medicine, and in order to give it for free is just 30% of the total expenditure. So the whole public health system will be completely out of funds. And we are not talking about Africa, we're talking about France. Another indicator is what's going on in the region. In 2012, Mexico had 2,500 requests for patents. Argentina says 54. There is an irresponsible use of the patent system. In China in 2013, over 2,000 patents. So remember what I just said. What is innovation? Innovation is zero in 2012, and here 2,500 patents of new products. This is the famous document mentioned this morning, which is one of the solutions as Susan said. This was written by Carlos Correa, sponsored by the WTO, translated to 5 languages, workshops in 50 patent offices in the world. Currently, this does not exist anymore. If you call the WTO to call for this document, they will say they are sold out, when I know they have hundreds of thousands of issues. Some things just disappear. The third point or item, the biggest threats to access to medicines. Forecasts say that the world pharmaceutical market says that in 2012, $30,000 million. In 2016, it would be twice as much, 70 million. All this increase will be in developing countries, because industrialized countries will not increase but decrease their expenditure in medicines. So they are trying to send us a message that medicine consumption in our countries, in developing countries, would be something about $1,000 a person a year, as in the United States, when in India, China, and Brazil, they spend less than 1/3. So the market will increase, because this is how much you should take. I'm sorry, I could not translate this, but the expenditure in medicines in the United States is about $1,000. In Denmark, it's 300. So we should change the consumption model. This is one indicator that with $300 it is enough to have the population in good health, because nobody can say that Danish or Dutch people are in poorer health than the Americans that are spending so much money. So this model needs to be changed. Now, let me refer to what happened in the World Health Assembly this year. This assembly is the most obsolete meeting that exists in this contemporary world. Something that probably worked properly when at the beginning of the 20th century, but not now. This was a criticism to Margaret Chan. She continues, says that I am following my member states, but their member states are not going the same direction. So she cannot follow anybody, or if she is following anybody, she is following some of the member states. This is something else that was mentioned this morning by Susan. This is what is going on. The WHO has been privatized. Part of it is owned by Bill Gates, and there are no regular public contributions by member states, but there are contributions by philanthropic foundations or by voluntary constructions of member countries. So I said it is obsolete. In 1 week, there was an agenda with 75 items. If you check the agenda and you try to see the debate on the organization's priorities with the 75 items of a meeting that lasts 8 days, nothing is connected. even member states say, okay, I want to include this in the agenda, and I want this one, and I want this one. And since the WHO has no authority, they say, okay, include everything in the agenda, 75 items that you will not be able to discuss during the entire week. 15 decisions were made and 20 voluntary resolutions were made. That is, it is not enforceable on anybody. If you go to a WTO, every 2 sentences you listen to the word enforcement. The concept of enforcement does not exist. These resolutions should not be enforced, they are not compulsory, so new mechanisms should be found. This year, there was something very interesting. That is the first time that happened. 7 items were related to medicines, and let me make a comment on that. First, quality products, substandard products, or many other names that they cannot agree on. Argentina has invested a lot. Argentina is doing a very professional method, but after 3-4 years, Argentina is arriving to an action plan that would be voluntary in nature, and there is no money for it. That's the first. Then the follow-up of the CWG report. There was an attempt of a coup d'etat in the assembly because they started reading a resolution to support the demonstrative products, and Bolivia delegation was able to stop this. So there was a decision that was just a commitment that didn't make anybody happy. The demonstration projects is a distraction exercise suggested by Switzerland, the European Union, and the United States to delay the discussion of the real issues of R&D. Then the strengthening of the system to standardize medical products. There was some progress here because we deleted the concept of the harmonization meeting, but the concept, this idea of harmonization was still is there. So we won a battle, but this thing will come back, and we will again be forced to accept these standards that do not relate to public health, that are forced by the big manufacturing companies. The comment on the resolution suggested by China that I discussed with the Chinese delegation, because they do not say anything. There's nothing in there, and there is no progress to move forward with the mandate in this aspect. So it was passed, it was approved, there was no debate, but there's nothing new there.
Number 6, access to biotherapeutics or biosimilar products. Here we have to acknowledge that Colombia and Argentina scored the goal. They were able to get a resolution approved which would withdraw some WHO guidelines which were prepared without consultation with the countries and which were quite industry biased. They were withdrawn. I was talking to the president in Colombia a short time ago and told them this is not the end, that the fact that you have this resolution. This is just the beginning of a long discussion, and of the messages and suggestions I would make to you, to the region, is that on this issue you should be very, very consistent and working together if you don't want to have a problem, if you don't want the review guidelines to be even worse than the ones that were withdrawn. And this may always happen. And finally, the resistance to antibiotics. I think this is a good resolution, better late than never, because this problem is being raised by NGOs such as Ted Warner Work. They have been mentioning this for 15 years. There is a serious problem. We are running out of antibiotics. There are several serious risks, and WHO should be concerned about this. Of course, the resolution falls short of the problem because the resolution doesn't even mention one of the main causes for antibiotic resistance, such as the massive use in animals in a prophylactic way, and this is one of the reasons for the resistance, and the resolution does not mention this at all. The conclusions, for once I'm going to follow in time, and I will have some minutes to spare too. I believe that the conclusions would be: let's take things seriously and let's acknowledge that there is a structural problem here. The current model for R&D for pharmaceuticals is not working. And let's not talk about demonstration projects, donations of drugs, projects of PPPs and PDPs, where Bill Gates will donate 50 million to develop research on this or that. But there's a substantive issue here, which is not something that is hurting developing countries too much. That is, the supply of medicines in the north is at stake, and they are not able to pay for the cost of the current model. And finally, I'd like to tell you that the solution, I believe the most substantive solution, there are many other possibilities, but the most thorough one would be to use Article 19 of the WHO Constitution, which says that the Health Assembly shall have the authority to adopt conventions on agreement regarding all matters that are within the competence of the organization, and once something has been agreed on in Geneva, it is submitted to Congress in all countries, and it will become a law. This article is part of the WHO Constitution. It was used only once in the Convention Against Tobacco. The idea stated in Carlos's and Claudia's report is that, again, we should negotiate a new convention which is binding as a way of funding research and development of medicines. And I will end with this comment and say that the issue, and the question is this issue of patents applied to medicine, has it been solved or is it still to be solved? Thank you very much.